Hi, my name is Peyton Henson. I'm a nursing student at the University of South Alabama, and today I'll be performing the Enema Check Off. So here's my badge, and now I'll scan the room. So upon entering the room, I will perform hand hygiene, I will verify the hospital order and the hospital policy, and then I will use two identifiers to identify my patient using the order form and his armband. So I see that this is Jaguar Jones, date of birth 8/25/1963, 8/25/1963. I will also verify if the patient has any allergies, and I see that he is allergic to penicillin and allergic to penicillin. I will also explain the procedure to my patient, and I will provide privacy, closing the curtains. So now I'm going to gather all my equipment, and I want to also make sure I have my IV pole and my bedpan. I don't have my IV pole with me today, but I do have my bedpan. Then I will perform hand hygiene, and I will don my goggles. Then I will make sure that my enema bag is clamped, and I'm going to take it over to the sink. And I'm going to fill my bag with 750 to 1,000 milliliters of warm water or saline for an adult enema. Then I would add my soap. Then I will gently agitate. And then I'm going to be priming my tubing. So I will unclamp this. And then I will clamp it back. Okay, so usually I would put this on an IV pole, but I don't have one today, so I'm just going to lay it on a flat surface. So now I am going to perform hand hygiene and don my gloves. Then I would raise the bed to a working height, lower the side rails, and put my patient in left lateral Sims position. Now I'm going to take my enema. I'm going to lubricate the end of the tubing. And now I'm going to take my non-dominant hand and place this on the patient's hip. During this part of the procedure, I want to ask them to take deep, slow breaths. Then I will spread the buttocks, and I will insert my tubing 3 to 4 inches. And then I will hold that on tightly. Then I will take my bag, and also with insertion, if the patient has hemorrhoids, I would ask the patient to bear down to facilitate the process. So I'm going to, I would unclamp and raise my bag 12 to 18 inches. Then if the patient was uncomfortable or was cramping, I would lower the bag and reclamp the tubing and tell them to take deep, slow breaths. So I will hold my bag until my enema is all the way inserted. Then I will take out the enema and discard. Now I will tell my patient to hold the enema for at least 10 to 15 minutes. I will have my bedpan near me at all times. So when the patient is ready to evacuate, I would help them to the bathroom, or we would use the bedpan, which I would put the patient's thighs on the smaller side and the buttocks on here. So when the patient's ready to evacuate, I will place this underneath them for them to use. So now that I'm done, I'm going to take off my gloves and discard, and then I'll perform hand hygiene. I'm going to document my procedure on the type and size of the enema, the time, and how the patient tolerated. And then I would document the color and amount of return, as well as how the patient was left after the procedure.